respected seniors, colleagues, team from the organizing committee, especially from Team South First, friends, ladies and gentlemen, especially those who are watching us live who are not physically present here. Very good morning. I'm going to begin with a story of a young engineer in his early 30s who lived a few thousand kilometers from us in Kanpur. He was a happily married man with 2 children, and one of the things that bothered him was his lack of hair, an issue that we would be addressing later on in the day. So he decided to seek help, and he went to a hair clinic, got a consultation done, and then went on to get a hair transplant. And a few days later, he had to be moved to a ICU, and within less than 3 days of the hair transplant, he passed away, leaving his family, his wife, his 2 young children in grief and untold misery. This was in November 2024. And in the March of 2025, in the very same city of Kanpur, there was another engineer, also in his 30s, another happily married man with 2 children, who went and consulted a person and went for a hair transplant. And after his hair transplantation, within less than 3 days, he also lost his life. Now, he left parents, spouse, children in deep, untold misery. So what was common between these 2 people? They had gone to the same person, and they had the hair transplant done, their fatal hair transplant done by the same person. Then came the stories that this person was, who was she? These are the 2 men who lost their lives. Who was she? Was she a dermatologist? That was the initial rumor. And we were wondering, because dermatology is not that large a community in India. We are just 18,000 people, and hair transplant community is even smaller. And then they came this news that she's an MBBS doctor. And after weeks of investigation, it was found that she was actually a dentist. She had rightfully earned the prefix of DR before her name. She had gone to dental college and did her 4 years of BDS, 1 year of internship, but she was not a medical doctor. And it took this family months of hardcore fighting and struggle to lodge this complaint. Now, what are the important questions here? Could it have happened if it were a dermatologist or a plastic surgeon who did the procedure? Of course, it is possible. Accidents can happen in anybody's hands. But then why do we have laws? Why do we need licenses? I have been driving a car with a license for decades now, but can I drive a truck? Am I licensed to do that? So why do we need to take precautions? Why does one wear a helmet or a seat belt even if you are a good driver? Because things can go wrong. And what does the Indian law say about this? I will go back to this point. But now I move on to the crux of today's talk, that is the quackery issue. So what is quackery? Why are we dermatologists talking more about quackery than other specialities? Why should we fight quackery? What propagates quackery? and what does India need to combat quackery. I'll talk a little bit about my personal battle, and hopefully I will end it with a rousing call to action so that everybody who's watching, who's listening, is moved to take action. So the Supreme Court of India had defined a quack as a person who does not have knowledge of a particular system of medicine but practices that system. So if you take my own example, I studied modern scientific medicine, also known as allopathy, but if I prescribe an Ayurvedic medicine, then I would qualify as a quack. I would deserve the term quack. Same way, if an Ayurved person who studied his science practices hair transplantation, then that person would be a quack. So this is not what we are saying. This is what the highest court of the land has said. Also, if you have a degree but you have not been registered with your local state council, then you would qualify as a quack. And I'm glad to see members from the Telangana Medical Council here. I'm going to talk more about how they have contributed to this fight and how they've been instrumental. So why are we fighting quackery? One of the most common accusations that all anti-quackery crusaders face is that we want to safeguard our practices. Now, is that all this is about? Is it about protecting our turf? Do we even care? Trust me, in today's world, any half-decent dermatologist has enough and more patients, and in fact, more patients than we want to treat. So here, it is about having intolerance to deception, because that is what quackery is about. It is mainly to protect our patients and our general public, and also to maintain our morale. Now, morale of whom? Morale of our young doctors. Because imagine if all the youngsters nowadays decide that medicine is too hard, and it is hard. I'm not going to lie about it. Medicine is extremely hard. Getting into it is hard. Getting through it is hard. And then once you're out, you don't get paid well enough. You have long hours, no weekends, no social life. It's not an easy life. But then if we did not have youngsters who are enthusiastic and committed to service, taking up this profession, who's going to treat all of us as we get older? So this is not about protecting our turf. Now what happens? What are the consequences of quackery? Now you might say, how many people would die because of quackery? The point is, we do not know. Now here, when the first person, the engineer who was working for the UP government, died in November 2024, this did not come out. And then the same lady went on to do the second hair transplant in March for another engineer who also died. So that is a failure of the system. It's a failure of our entire society, I would say. And we all need to get together to prevent that. So not all of us are going to die because of the ills of quackery, but there are so many things that could go wrong. You could lose your money. You could lose your time. You could lose the system of faith in modern medicine, because when you go to the wrong person and you don't get the right result, you might think that there is no point going to any other doctor. And this is something that we keep hearing all the time. So why is it that quackery is so prevalent in dermatology? Because people think that treating skin and hair is easy, it is visible, you don't need to touch, you don't need to use a stethoscope, you don't need an ultrasound or a CT or an MRI to understand what is happening. And then it is our own fault. When I say our own, I mean our dermatologist's fault. Because who were the ones who trained the initial set of unqualified people in all these procedures? It is our own people who did unauthorized trainings. Online courses. Imagine you learn hair transplant over 3 days. Online, that too, over a weekend. Is that how you want to be treated? Now, people think that skin is only about creams, about topicals, and that creams can't harm. And in the panel discussion that I'll be moderating today afternoon, which is going to focus on the abuse of topical steroids or steroid creams. I'm going to talk more about this. And also, of course, the industry, the cosmetic industry, the pharmaceutical industry. Half the time, many of these medical representatives do not understand that whom they are going to, the so-called cosmetologist, is not even a medical doctor. How do they know that? And then, of course, the public, because finally you have to take responsibility for your safety, your health. You need to plug in your seat belt, wear your helmet. Now, I am not into victim shaming at all. I am not going to pass the buck completely and wash my hands off. But one important thing I want to share with you, that is something I call the cosmetology conundrum. What is cosmetology? Now, cosmetology is a vocational training that the government of India offers, and it involves haircuts, hair colors, manicures, pedicures, doing makeup. Now, am I saying that somebody who's a cosmetologist does not deserve respect? Absolutely not. I love makeup. I love getting my hair done, nails done, all these things. So, and I believe in dignity of labor. But the point is that we doctors are not cosmetologists. And if the earliest people who call themselves dermatologists and cosmetologists had not done that, I strongly believe that today's situation would not have happened. So you will see here that the entry qualification for a cosmetology course by the government of India is a grade 10 pass certificate. So we have all passed our class 10, but we have also done more. So if you're a dermatologist who is listening to this and you want to convey to your patients that you also provide cosmetic dermatology or aesthetic dermatology treatments, just say that, because we have to make the semantics clear. We have to define the boundaries. Now, what are the current regulations that are there to prevent quackery? We have the Clinical Establishment Act, which means that if a doctor wants to set up a clinic in Telangana today, they need to get a permission from the district medical and health officer, and then they are going to check whether this particular doctor is licensed to practice in Telangana, which means that they need to have a qualification which is registered with the Telangana Medical Council, and so it goes on with every state in the country. But the problem is our population, our numbers, and ghost faculty, ghost doctors. And this is not something that's unique to us. It's happening in Korea, it's happening across the world. So when a real doctor lends his or her certificate or actually goes and visits a clinic for 2 hours a week, then what is happening on all the other days of the week, on all the other hours of the day? Who's sitting in that clinic? Who's treating patients? Who's doing procedures, whether it's a filler or Botox or PRP or hair transplantation? So I think we physicians and doctors need to take responsibility for this. Then we have National Medical Commission rules. We also have the Dental Council of India's rules. We have hair transplantation rules. And what does it say? So in 2022 September, the National Medical Council Commission had given out this circular which said that only dermatologists and plastic surgeons who have had adequate training and have adequate infrastructure are allowed to do this. And why is that important? Because I could have great skills, but what if I have to operate in a shabby place without the proper sterile precautions? So you need to have not just the skills, not just the qualification, but also the right infrastructure. And then in the same year, in December, the Dental Council of India came out with a public notice which said that MDs in oral and maxillofacial surgery also could do the same procedures, facial aesthetic procedures and hair transplant, but they have clearly said that people with BDS or people with other MDS in other specialities, could be oral pathology, could be orthodontics, whatever it is, they are not supposed to be doing hair transplantation or facial aesthetics. Now, there are many questions here. The question of why is hair transplantation such a big public health problem that dentists also have to pitch in? Don't we have enough providers in the country? Now, if you have something that is of grave public health importance, like tuberculosis, like leprosy, these kind of things, now suppose a situation comes when all the medical faculty is not enough to train, then maybe we could have dentists helping us. But hair transplantation, why should they? Now so this is being challenged in 2 high courts by dermatology associations. As we speak, we have cases going on in the Madras High Court and the Bombay High Court. And that is, of course, sub judice, so I can't talk. Now I will talk about something that gives, before that, I wish I could have focused on the signature of this particular public notice. This was not a doctor, this was a Mr. Whoever, who was the accounts officer, who was standing in for the authorized signatory. So the person who signed the December 2022 DCI public notice, which gave MDS OFMS the authority to do this procedure, is actually not even a dentist or a doctor. So now coming to the hope that we have, I'm going to begin with Telangana Dental Council first. We dermatologists are hugely grateful for this. In May of 2025, Telangana Dental Council has declared that dentists should call themselves dentists, should run dental clinics, and their clinics should look like dental establishments. So that was a huge victory for many of us, because I've had many a patient who said, who had side effects, that, you know, if I knew that this person was not a qualified doctor to do this, they are qualified to do dental treatments, then I would not have gone. So if you have clarity in the establishment, many a thing would have been saved. And then, of course, we have our heroes sitting right here. Telangana Medical Council came up with something very, very brave that was unprecedented in rest of the country. They wrote to NMC, they got clarity, and our chairperson and rest of the team here had declared that MDS in oral and maxillofacial surgery is not enough to perform hair transplantation, and that is the stand that Telangana Medical Council has taken, and I am truly proud to belong to this particular piece of land of India. And they have also done many unprecedented things. They have spoken about how we do not want our doctors to have random unrecognized degrees like A, B, C, D, E, F, G behind their names. So I have a MBBS, I have a MD, both of which are qualified, recognized by the Medical Council. I also have a PG DMLE from the National Law School, Bangalore. But that I am not going to put in my letterhead, because that is not recognized by the Medical Council. It's just going to add to the alphabets behind my my name there. So if all of us did that and made sure our colleagues did that, I think patients would have some clarity there. Now, following the example set by the successes that we've had in Telangana, Karnataka people have followed suit, and so have people in Rajasthan, people in Maharashtra, and these are some of our, and people in Andhra Pradesh, of course, our own brethren. So this is something that is, once a point comes when the momentum takes off, we've seen that with Dr. Shivaranjani's fight, and Dr. Shivaranjani happens to be an old friend, a junior from my alma mater, JIPMA. So once that point comes, then there is no stopping us, and we hope that this is the point of no return. So what does India need to combat quackery? We need advocacy, we need better laws, we need awareness, because justice is, the wheels of justice are very slow to turn. So before that, what is powerful? Social media is powerful. So all of you who are here, we have some very nice fancy props. Please tag South First, please tag derm activists, and make this go viral, because that is going to have immediate effect. So one of the things that we all have been trying to do is to aid enforcement of the law, because Telangana Medical Council can't be everywhere. We need to gather evidence, we need to submit it to them, and then we need to be partnering with them to get hold of all the culprits here. And as recently as 2 weeks ago, we had a huge partnership between media, Telangana Medical Council, and the district health and medical officers, which resulted in the closure of a clinic called Facile Clinic in Hyderabad. Now, I will talk a little bit about my own story. So this year I was appointed as the chairperson of the Anti-Quackery Legal and Ethics Committee of IADVL. That is a pan-Indian one. And I was invited to a particular interview, and during that, it was nice and easy, and there was an hour-long unscripted conversation in which a social activist, Purnima, had said of the word BDS doctors. So I said, let's call them dentists. I did not say they did not deserve the prefix. Of course, they deserve it. The point is that if you are wearing a apron and walking around, white apron, and having something with doctor embroidered on your left side of the chest, and walking around in Asian Institute of Gastroenterology, nobody is going to think that you are a PhD in economics or that you have an honorary doctorate in social work. They would assume that you are a medical doctor. So here, one of the things that we want to fight for is not using the word doctor prefix if they are not doctors, if they are in a clinical setup. Now, this is something that one of the US states has taken up. They have said that nurses who have a PhD, and PhD in nursing is not easy. It is hard work. It is hard earned. But these nurses who have a PhD have been forbidden from calling themselves doctors, because these nurses work in hospitals and they don't want patients to be confused about who the medical doctor is versus who the nursing PhD doctorate is. So that is the point that we were trying to make. Of course, there were thousands of very nasty comments, personal comments about my caste, my qualification, my spectacles, my number of boyfriends, my character, and of course the 4-letter words, 5-letter words, comments about menstruation, all kinds of very, very nasty things. But then when trouble comes, so do saviors. So I had all these people rise up to the occasion. I had media rise up to the occasion, and one of the most important turning points in this whole thing was an article written by Sumit Jha, who's sitting right here, thanks to South First, and he wrote this fantastic article, which became the talking point across continents. It was discussed in UK Doctors Forum, it was discussed in Canada, it was discussed in the US. It became truly viral, and that was when the Telangana Dental Council took notice, and that was when all those notices that I showed you actually came out. So always when you have troubles, please be sure that there is going to be help around. So I am going to end this with a call to action to all dermatologists, to the media, to the people of India, that when you see something happening that should not, when your heart trembles with emotion at the sight of injustice, then you are a comrade of everything good. You are a comrade of ours, of social activists, anti-quackery activists, and please remember that the silence of good people is much more dangerous than the brutality of bad people, and I hope we are going to end this silence soon. Thank you.